Hello, my name is Zoe Ortiz, and I will be presenting my case study on Hashimoto's thyroiditis. My main focus for this case is patient management. Hashimoto's is a chronic autoimmune disease that usually requires long-term treatment, follow-ups, and monitoring. For this case, Ms. Johnson, she is a 42-year-old woman who presents to the clinic with the chief complaint of extreme fatigue, unexplained weight gain, and difficulty concentrating on simple tasks. She has also been experiencing depression, memory loss, and a cold intolerance for quite a while. Her symptoms have been affecting her daily functioning and her quality of life. There is no known prior thyroid diagnosis, and she has been tested before with blood work. Ms. Johnson works as a call center representative, so she is sitting long hours throughout her day. She goes to the gym occasionally when she is not too tired on weekends and rarely after work due to her fatigue. She used to smoke cigarettes, but she had quit in her late 30s. She does not take any medication currently other than supplements that she takes for her hair and nails. Her diet is moderately healthy and she is trying to improve due to her weight gain. On Ms. Johnson's physical exam, findings that may support thyroid dysfunction include her facial edema, coarse facial features, dry skin, loss of body hair, bradycardia, and an enlarged thyroid gland. These findings, along with her symptoms, raise concern for hypothyroidism. To the right, you can see what an enlarged thyroid gland may look like, and the heartbeats for someone with bradycardia who has less than 60 beats per minute. And facial edema is when the face swells up. For Ms. Johnson, Hashimoto's was suspected because of her symptoms and physical findings that aligned with her thyroid dysfunction. Her fatigue, weight gain, difficulty concentrating, and other signs made thyroid disease an important concern. Physical findings alone do not confirm Hashimoto's, but they do support the need for further evaluation. Blood tests are used to identify hypothyroidism, the result of thyroid peroxidase. TPO antibodies and thyroglobulin antibodies help support Hashimoto's more specifically. Thyroid ultrasound can also help by showing any changes of the thyroid, including any nodules or change in the size of the thyroid gland. However, diagnosis is not always straightforward because some patients may still have symptoms while blood tests may appear normal, and this is why diagnosis can be delayed till later in life. This is usually why people are misdiagnosed or become diagnosed later in life when constantly feeling the symptoms but not knowing what the cause is. For Ms. Johnson's diagnostic findings, her blood test showed an elevated TSH greater than 4.5 milli-international units per liter, while her T4 levels remained in normal range of 0.9 to 1.7 nanograms per deciliter. Her thyroid ultrasound showed decreased echogenicity, heterogeneity, benign nodules, and hypervascularity. Together, these findings support Hashimoto's thyroiditis. Hashimoto's is a very common autoimmune disorder and is found more common in women than in men. Women are affected 4 to 10 times more often, and in the general population, it affects approximately 4.8 to 25.8% of women, and for men, 0.9 to 7.9%. It is often not recognized until later in life, around the age of 54. This is because symptoms of the disorder can gradually get worse throughout the time. It can affect the quality of life by mood changes, body mass index fat, cognitive function, heart disease, strokes, and fractures. Hashimoto's may originate from genetic factors and environmental factors. In regards to the genetic factors, the X chromosomes and activation patterns make it susceptible to not be able to self-balance hormones. For environmental factors, these include smoking, viral infections, exposure to chemical compounds, excessive iodine intake, and vitamin D deficiency. Hashimoto's is caused by the immune system attacking its own thyroid gland. T cells trigger the production of antibodies against thyroid antigens. This leads to the destruction of thyroid follicular cells. Over time, this damage reduces thyroid hormone production and leads to hypothyroidism. Th1 cells contribute to the immune attack, Th2 cells help produce antibodies, and the Th17 cells contribute to the inflammation. There is currently no cure for Hashimoto's, unfortunately. Therefore, the main priority is to maintain the disorder long term. Levothyroxine is prescribed to patients to mimic the natural T4 thyroid hormone levels. Although this medication might not completely make the symptoms go away, when someone is first prescribed, the dosages may have to be adjusted throughout time to find an effective amount. Although this is the case, upping the dose is not always the safest route because it can cause heart problems and osteoporosis. Every person is different and the dosages must be individualized because everyone responds differently. Since symptoms tend to persist, follow-ups are necessary. Removing the thyroid is also an option and it can resolve a lot of symptoms, but it requires surgery and that can come with complications. And it is usually used for more serious cases. There are supportive therapies that may help, such as acupuncture, selenium, vitamin D, and diet change. Doing this, it can lower thyroid antibody levels and slow down the progression of the disease. While these may be beneficial, there still has to be more research conducted. Diets that are gluten-free or low in carbohydrates can help avoid worsening symptoms by not disrupting the gut bacteria as well. As mentioned in the previous slide, since there is no cure for this disorder, patients must know how to manage this long term. The patient must know that the LT4 can help regulate the thyroid hormone levels, but symptoms may still appear in some cases. Management is going to take some time and trials to see what dosages can be most effective over time. They should consider looking into or trying the supportive therapies to try alleviating the symptoms. Ms. Johnson was diagnosed with Hashimoto's thyroiditis after evaluation of symptoms, lab results, and thyroid ultrasound. She was prescribed levothyroxine to help manage with thyroid hormone support. Follow-ups are needed to help manage symptoms since every dose is individualized and takes time to see what is most effective. Symptoms may remain despite treatment, therefore, long-term management is required. Ms. Johnson was educated on the nature of Hashimoto's and the need for follow-ups. Overall, Hashimoto's thyroiditis is a chronic autoimmune disorder that damages the thyroid gland and can lead to hypothyroidism. In this case, Ms. Johnson's fatigue, weight gain, memory problems, and difficulty concentrating were consistent with the disease. This case also shows that the diagnosis can be challenging because symptoms are gradual and may overlap with other conditions. Since there is no cure, long-term management, individualized treatment, and follow-ups are essential for improving patients' outcome and quality of life. For a clinical thinking question, would you suspect Hashimoto's in a patient with fatigue, weight gain, depression, and difficulty concentrating, or could these symptoms be mistaken for something else? Hashimoto's can be overlooked, misdiagnosed, or diagnosed later due to nonspecific symptoms. These symptoms can overlap with many different diseases. These are my references for all the information from the past slides, and these are my image references.